Okay, we'll go ahead and get started. I think we'll still have some folks trickling in. Just a quick reminder, we are on Zoom, so please mute yourself if you're not speaking. I think we're going to have a relatively small group today, which is great. We're going to have some time for conversation. This is really going to be more of a conversation. My name is Julia Dobbins. I work for the National Healthcare for the Homeless Council. I am our Director of Medical Respite Care. And today we're going to be talking about supporting peer staff through the pandemic. Again, really focused more on a conversation about what this looks like, how communities have done it, what works, what's challenging, really sort of diving deep into how we support our peer staff. Just quickly, a few housekeeping items. Just want to acknowledge that this webinar is supported by the Health Resources and Services Administration, or HRSA. And also a quick disclaimer that the content and opinions expressed in this presentation are solely those of the presenter and not necessarily those of the National Healthcare for the Homeless Council. Second piece, at the end of the webinar, we will have a survey launch for feedback. Really highly encourage you to fill out that survey, that evaluation survey. It's helpful for us in our education and training, how we do this work better, and we make sure that we offer training and opportunities that are really relevant to the work that you do. So moving now into our discussion, we have a couple of speakers with us today that I'm excited to introduce. In true homeless service fashion, one of our speakers was pulled into a crisis. I think nobody on this call is surprised by that because that's the reality of this work. But hopefully Ashley will be able to join us soon. Ashley Olsen is a team lead with Do Good. Oh, Art, I'm going to mispronounce it. Say it for me real quick.
Do Good Multnomah.
Multnomah. Art Rios, who just spoke, you heard, is also going to be speaking with us. He is a team lead as well at Do Good. And then Brian Bickford is going to be our moderator for this conversation. I'm going to stop sharing these slides so we can just look at each other and have a conversation. And Brian, I'm going to pass it over to you.
Thanks, Julia. First, just wanted to give Art an opportunity to introduce himself, and then I will introduce myself after that. Art, you're muted.
Technical difficulties already. Once again, Art Rios Sr. I use he, him, his, them, they, those pronouns. I work for Do Good Multnomah. I'm a consumer with my HCH, which is Central City Concern, and I currently am the chair for the National Consumer Advisory Board for NHCHC for the National Healthcare for the Homeless Council. I've been doing this work for about a little bit over 25, almost 30 years now. It's great to be a peer to those that are still unhoused. I'm trying to get people to stop using homeless or houseless, and I just want to say unhoused and need a safe place. Stability is something that we want to give folks. And last but not least, I always hear about housing first. I want to change the model over to human first, because if you don't know you're human, how can you house them the right way with stability and permanent supportive housing? Brian.
Thanks, Art. As Julia introduced me, my name is Brian Bickford. I work for Elliott Community Human Services. I am currently the regional manager for our Central Massachusetts PATH team. Also am the current chair of the National Healthcare for the Homeless Council's Clinicians Network Steering Committee. I'm super excited to be here today and to speak with you all, have a conversation with Art and the rest of you just around how do we support folks with lived experience. This is something that I've had and worked with peers, whether it be recovery coaches, peer support specialists, whether it be health outreach workers, all of the different names that I think regionally are different, but really we're talking about folks who have lived experience and bring, a wealth of knowledge and experience and relationship to the work that we're doing with all of the folks that we're serving. it's been about 15 years or so for me that I've had the pleasure to work with folks with lived experience on the teams that I have been part of. Things I've really appreciated, but also have seen some shifts in organizations around how we identify, how we support, and expectations of folks with lived experience. So that's really something that we want to focus on today, is just how are we as team members and organizations supporting the folks who have lived experience, that are part of our team, and I would say most of the time are the most valuable part of our team. So without anything further, we're just going to jump in and start with, I have some questions that I'm going to be asking, and given Art an opportunity to respond. I hope that if folks have questions or that they would like to ask, don't hesitate to put those in the chat. And we will do our best to try to cover those and address some of those questions, assuming that we do have time. So thank you all for being here, and we're going to jump right in. Art, the first question that I have is, what supports help you to be able to do the work as a peer in an effective way?
For me to be a good support person and to be that peer is when we receive somebody new that comes to our organization. We always look for that soft handoff. We want to get to know them a little bit. What are going to be some of their needs? What are going to be some of their wants? We already know they want housing. So what we do is we look for, safe, secured housing in the locations they want. So we communicate with our folks with apartment complexes, medical needs, drug and alcohol treatment. It just depends on, what our folks want at the time. But we look at it as our first step is that soft handoff. What do I mean by that is like introducing them to our program and taking them around, showing them what services we have in our program. Our program has a pantry on Wednesday, laundry twice a week if they need it. We do laundry cards if they don't feel safe with their clothes going out to somebody else to wash their clothes. We work with men, women, couples, our LGBTQ community. We also look at that we have AA and A meetings that are really close to us. We will also go to a meeting if they like, we just let our other case managers and staff know, like, hey, we're going to do a meeting today with somebody. We just want to make sure that they feel safe and to build that, true authentic relationship with that person. And I would say out of 35 employees, I think each and every one of us brings that standard to about 100 folks every day that we're at work. Because if you don't build that authentic relationship with them, then they're not going to trust you because they've been told, oh, yes, I'll give you this, and they don't get it. So we just try to make sure that, the soft handoff from a team lead like myself and a peer support to a case manager or even to my program manager. We just try to make sure everybody has a little bit of who is who and let them know, like, come to us at any time. And we have 24-hour services. So we always have somebody on site to take care of those needs.
Thanks. And in terms of kind of the organization that you work for, what are kind of some of the structures or systems that your program or that any program needs to be able to support their peer staff in their role?
Well, what's pretty cool is we have a mobile support team as well. It's our mobile housing support team, and they have a couple peer support folks on there. So what happens is, say I get somebody completely documented, ready. I've got an application to an apartment complex, and it's time for that person to go. So we hand them off to our mobile housing team, and their peer support now will work with those folks to, you know, take them to their appointment, to, sign their rental agreements. We'll take them to, pick up furniture or anything that person needs at the time. So we, as our case managers, team leads, and staff will work with our mobile housing teams, support specialists, and say, hey, here's an introduction. Goes back to that soft handoff, because now we're introducing them to somebody new. And so that peer support now steps in and works with that person to get them into their housing in a good and safe, proper way.
In what kind of internal culture within your organization or any organization do you think would help people want to continue to do this work and to stay within that organization?
So what we do is we do a peer support. All of us that are peer supports, we get together on Wednesday. That's when all of us are there and we sit around and we talk about our participants that need certain services. So what we do is we talk to one another and find out like who doesn't have what service from one area of what a person needs. So we'll do a lot of resource sharing, service sharing, even when some of our case managers that are not peer support, but still doing that peer work, once they find information on how to get certain documents or certain housing, we try to share that in an email real quick. We'll print out anywhere from like 40, 50 applications to an apartment complex that may just have, maybe one, maybe two, but we'll get everybody to sit down with us and just start doing a massive, um, rental agreement with them, and get it out to that apartment complex. So we're like constantly sitting down with each other on separate sides of the week, and then on Wednesday we just get together and we just talk to each other. And what's the cool thing about it is I always try to check in with each and every one of my folks and the later part of the week's folks and say, hey, what do you need? How can I support you as well? So it's not just supporting the people, but it's also supporting my team in a bigger avenue, because they might need something more than just resources and services. They might need, hey, I'm overwhelmed, I need a day off. Okay, let's make that happen. So it's helping them as well. And they've done it for me, and we'll keep doing it for each other.
All right, in terms of kind of you all sitting down together, and that sounds like a really supportive concept and meeting that you're having. How often would you say that you and kind of your team or the larger teams come together? Just in terms of like how many hours a week do you think you all are engaging around supporting one another and resources and that sort of thing?
Well, like we have two shifts. We have a Sunday through Wednesday shift, which is like from two groups. One works like a 7 to 6. The other one starts at 10 to 9. And then our night shift comes on. And then that also happens on Wednesday through Saturday. So with about 8 people beginning of the work week to everybody on Wednesday, and then 8 to 10 people at the end of the week, I think we're constantly working with each other. Like even on our days off, some of us get a phone call and be like, hey, your client or your participant or this person is needing some help. Do you mind if I help that person? And we just support one another that way. So we can keep moving our clients and our participants in the direction that they need to go. So I'd say I check in with every person literally almost every day on my team. And then we also do what is called a crossover at night, every night. And that's another 5 to 6 people that are there at night. And so we're checking in with them, and they'll leave like us notes or emails or in the way of, hey, your client came in, said he has a doctor's appointment on such and such day. We put it in there so I know when I get in, I'm going to make that phone call to get that person a ride. Because I mean, they're working night shifts. So I mean, I think for one person, I think we're doing it about 20, maybe 25 hours during our shift from like my Wednesday or my Sunday through Wednesday, just myself, and then we have our program managers that, that if we need advisement or check in with them, we'll go check in with them and be all like, hey, is there any projects or tasks that need to be done during our week? And so it gives us a chance to grab one another and say, hey, let's do this buddy system and let's do these things together. So it could be more hours.
Yep. And just continuing along, talking about checking in with the program managers and that sort of thing. How do you feel that your program integrates kind of the peer staff's feedback into changing the program and improving the program?
I think for a lot of us, and doing this work, and a lot of people that we hire come from the community that have had lived experience within addiction, homelessness, mental health. And so it's like when they come on and come work for us, we as peers, like we'll do some walkthroughs of basic case managing, basic peer supports, basic, just letting them know what we have in our program and what we provide for our participants and our clients. It's always a great way to, get them to learn something new. So when we hear that someone's been a peer for like a couple years, we know they're already doing this work and they've done it before. But for us at Do Good, we just like to try to get them to understand we're here to support one another. We're here to support our program managers, and when our program managers aren't on site, us team leads take over, and we take on the tasks that some of the tasks that they would normally be used to doing tours and things of sort. But also it's getting those newer folks to understand, like, we're there for one another. We're one big family. And we're supporting, about 100 people every day of safety, services, resources, and mainly let's sit down, have coffee and food together.
Mhm. What are some of the things that either you're within your own experience or that you've seen within your programs? What supports have really helped or worked for when you have someone who is really struggling? You have a peer support worker who's struggling with their mental health, or potentially has relapsed, or is struggling with substance dependence. How would you kind of help to support folks in those situations, and what do you see as kind of the organization's responsibility or ways that the agency as a whole can help support folks?
That's funny that you say. My organization, instead of seeing one of our peer support that that may have relapsed or has used, and we see it, some of our folks, I would say, some of our executive folks, will listen to what we're saying about our other peers and our other case managers or team leads and be like, hey, um, what service do we have to offer this person? Maybe some outpatient treatment, or we have a mental health organization that they will come out and talk with us, or they will talk to our participants as well.
Mhm.
So we have that in our system to where we're not going to say, okay, you're fired. No, hey, do you want some treatment? And we will help you. So some people have had the opportunity to take a week off and take care of what their needs are. But what happens is it comes from a upper level past our program managers into our executive level folks, and they will see them through um, whatever it is in mental health or in addictions or suicide tendencies. Um, I've only been here just under a year, but we have so many different supports that comes from the executive committees and from our board of directors um, that sit around the table. It is just like awesome that they're able to say, if you have a problem, let us know. We will help you, and you're not going to lose your job. You're going to take care of what you need to take care of because this is really, really hard work. And compassion fatigue kicks in pretty quick. I'd have to say compassion fatigue because um, some of our folks recognize some of the folks that are in our program, and they were past folks that used to run and gun with each other. So now it looks a little bit different, and so we see it, we catch it pretty quick, and we ask them if they need help or support, and we take it to another level.
And Art, that leads me to another question, something that I was hoping that you could touch on. When you were saying just around, you know, compassion fatigue or vicarious trauma, and those sorts of things are very real, and probably even more so with folks who have the lived experience, and you're seeing some of the things that you have gone through in the past, and like as you said, even seeing, you know, people, places, and things that you have experienced. So I'm curious as to how do you, as a peer and as a team leader, how do you balance those kind of past personal relationships that you have within the community, with individuals who you or your team might be serving, and how do you create, you know, how do you balance it, but also how do you create like boundaries and in what you're able to provide and help people with?
Like I told my bosses, going from like an on call to a case manager to this team lead, and they've seen the work that I've done over the last, few years to, coming into this work with them. And they asked me about how do you keep your boundaries? I'm like, well, I keep a lot of personal things to myself. Um, you know, uh, and I have seen a few folks that have been there that actually know me and my son, you know, and that's sometimes that little personal conversation that will come out from a participant or two, and I'm like, I really try to keep my son very private while I'm here at work, and uh it's a okay balance, of who I speak to, but I really try to keep like a lot of my private stuff to myself. And I always tell my clients and my participants that like, hey, we're here to work with you, work on you, get you moving on. You know, I can tell you some of the past things that have happened to me. That sounds just like your story, but we're not here for my story. We're here for you. And it's just a way to where like um we can see what team leads we feel or our case managers or our staff that really get close to some of these folks because it's their first time ever doing some of this work. um and we try to explain like, hey, watch how you say certain things to them. It can be triggering because you might say, oh, in the past, like I've been clean X amount of years now, and they might use that against you later because they can tell that maybe you did relapse or something. So they might use that later against you and bring up rumors. And so, like, we try to squash those rumors and be like, hey, you may have heard it the wrong way, but it's been a really good um, way to teach some of these new folks, like, not to give up too much of their information, but just like, oh, I've had that past experience. What did you get out of it? What did you do to change your experience to make yourself better? This is the experience that I had, and this is where I am today. So yeah, it's really trying to hold your boundaries, but we sometimes get that one person that is so high strung and needs attention all the time, and some of us will just like, okay, we'll identify the person that can go talk to that person and say, hey, you're gonna go talk to this person, ask them how they're feeling, like just a couple little basic questions to, like, what we call it, bringing them off the ledge of wanting to blow up on somebody or being loud, and bringing them off the ledge, sitting down with them. Let's go get a cup of coffee. You want me to go make you some food? I can go in the back. We can go in the back. And then there's a couple staff member with that person, just for someone to watch, sit down, eat with them, and just listen to them, as sometimes that good factor as well too, to help them. And during that, I'll even ask, would you like some mental health services, or is there some treatment you would like to do? From my experience, some others do it a little bit different, but I ask those harder questions. Some folks feel very, very scared to ask those questions because they don't want to say something that may be like, oh, they were telling me I had to have treatment or I had to have mental health come in. I offer, you know.
Mhm.
So it just depends. It just depends.
And I'm just curious, and I had said in kind of my opening remarks that something that I had seen just in terms of culture, and I think that there's been a shift in this since the I don't know, 15-ish years ago when my organization first had peer support workers, was that we it's a lot about the boundaries and the things that you were just talking about, where we understand, or we were starting to understand and recognize that people with lived experience can engage with folks in a much more I think concrete way and form relationships with folks because of the mutual experiences that they've had. The issue that I know my organization had years ago was around that sharing of information, which was, and I know you talked about the balance, but my organization, especially our HR department, those sorts of like executive folks would have a really hard time with people sharing their experiences because, as social workers or therapists and doctors, we're especially in the behavioral health field, we're really taught to not share your own personal experiences and that sort of thing. And so I know that it took us a long time to, I guess, explain to and get our kind of HR department and our executives on board with how valuable sharing of stories actually is and are for and that it's really somewhat of an expectation of a peer is that you're using at times appropriately, you're using your experiences as a way to connect with people and to help people. So have you had experiences within this organization or others where you have, there have been problems with, sharing or oversharing or that sort of thing?
Yeah, I worked for one organization, and um, being in my recovery, and when I tell people in my recovery looked a little bit different than a lot of different people. And prior to my recovery, a lot of people knew who I was and what I was about and who I associated with. And so I worked for an organization that I was also a supervisor at, and I worked with one other supervisor and about 18 people on a shift, and we watched over 200 people every night in the shelter. And it was it was pretty crazy because for me, I knew at least 160 people out of that 200 people, and they all knew me prior to my recovery. And so it was like a lot of them knew my backstory, a lot of knew of them where I came from, a lot of them knew uh what I was about, and because sort of kind of like this Billy Badass guy that was in his addiction, that didn't care, and but I was still doing the same work while in my addiction. And so um it just was like a lot of things kept going to HR, and they'd come ask me and go, "Hey, Art, we hear you're doing this and that," and I'm like, "Wait, what?" Like, no, this is uh going to be a really hard conflict of interest because of so many people that I know here. Um, that after like 1 year, I had to resign because I kept having HR come and talking to me all the time. But with this organization that I have now, we're a veteran run and homeless COVID shelter, and we put two of our hotel shelters into one. So going from like 40 people at one and 60 people at another, now we're at 100 people on one big campus, one big hotel site. Um, like those rumors don't run around like it did in this shelter or that past shelter. This one, this one gave me the chance to learn and meet new people with the occasional one or two people that I've known. But it's like, oh, that's Art. I used to see him at Sisters of the Road, or he's over here at the coffee shop and he's doing this work. They've seen me in a different capacity than my addiction back then. So it was something that was different, was nice. And I always tell my program managers, if I don't get to share my story with somebody, then it's really hard for that person to understand, because then they feel that I'm just some kid that got to go to school and get his master's of social work and be able to come here and never had anything. But if they know a little bit about me and I can share what I want to share, it opens up that conversation a little bit better. They get more understanding, and they're more likely to trust me and not trust me.
In terms of your program and your experience, within your current organization or past, what have been some of the opportunities that have been kind of afforded to you to grow or advance within your organization? And what are your thoughts on, what other programs should implement in order to make sure that we're supporting folks with lived experience at all levels of our program, and not in just some pockets?
Well, it's sometimes some folks want to just be in those pockets, to say. Some just feel comfortable being in the pocket and be like, okay, do you have a training on trauma informed care? Hey, do you have mental health first aid? Hey, there's a class online I want to take and I don't have enough PTO. Can I find a way that I could still come to work and do the webinar while I'm at work, but I'm still going to get my work done? Like, my organization is willing to work with us all the time. And that was the one thing with my program manager. Um, she had already heard about who I was and what I was in my community, the phone calls I would take. And so it was a way to strive on still doing my outside work, but still coming to work every day, doing the work I had to do there, on top of being on call, helping here and there, then becoming a case manager, getting that load of folks and still doing my calls and still working with my folks and still striving my folks forward. And then it was picking the brain of my program manager. And one time she had just said that sometimes we may not have the answer, so we might just make shit up as we go, and it works. And then I was like, wow, is that how it really works? And it was like, yeah, because you get to set the boundaries of what it is that you're doing. You do not want to cross boundaries, but also at the same time, you want to be able to think outside the box, bring something new. If it works for that person, it may be able to work for somebody else in a different way. So we get to make shit up as we go because we're still moving and pushing people in a forward motion, not a backwards motion. And that's why I said at the beginning, that soft handoff. Because if someone comes to me, I want to see where they're at in their own box and see how I can push them out the box to keep moving forward. And me and that person's just going to make shit up. Be like, hey, this worked for you. What's next? What's going to work for you? What's next? Things of that sort.
In terms of the supports that you've received or the supports that you've given as a team leader and supervisor, what do you wish that folks here that might be supervising or have peers on their team or work with peers, what do you wish those folks would understand or know, something that they can carry with them from this session?
So we're going to get into the whole, like, what is your self-care? For my self-care is I like to meditate while I'm at work because it can get stressful. So I can go to my little office, go make me a pot of coffee, sit, have a cup of coffee and just meditate for a little bit. I bring sage with me and I'll burn a little sage at work. I have a few folks that I'll smudge for. I have a few of my clients and participants that they would like me to smudge with because, it's just they feel like they have this bad energy or something, or they feel like, oh my God, everything is about to like in my world and I'm going to lose my housing here and be kicked out of this program. And it's like, no, you're not. We're not going to kick you out. We just need forward progress. So it's just having small little conversations, talking to my other team leads or my case managers. Hey, I'm not doing too good. Can I talk? Just asking them to talk for a minute. And I have a good open door policy for my case managers to do that, as well as my program manager has it for me to come talk to him at any time. But I can talk to either one of the program managers at any time. And it's just a good way of, I take at least 10 minutes every day to meditate, to self-care, drink some coffee, drink some water, rejuvenate myself and get back out there and do my work. I don't let a lot of things bug me at work because it's not about me. I don't bring home life to work. I don't bring work to home. Um, I've done this work for so long. I've learned how to just shut down work. But in the supervisor's position, it's a little bit different when they say, hey, we need help. We need support. Can you come? So after like this webinar, I'm going to be on the road. And then I'll be listening in for our board of directors meeting, so it's like I'm going to be there to help support. And I told my program manager, I said, the support that I'm going to do is I'm just going to sit behind the desk and, let Ashley do what she needed to do. I wish she was here today so she could put her sense of what we do at Do Good. But yeah, I do a lot of meditation. That's my self-care. I burn a lot of sage. I think I've already burnt about 100 bundles in the last 8 months. That's a lot.
And what are some of the characteristics, Art, that you would say are good for you in terms of a supportive supervisor?
For me, it's, people feeling free to come talk to me at any time. If I'm not already working with somebody or working on a project, come sit down with me, talk to me. Maybe they see something in me and just want me to talk, or I see something in them and I want them to talk. It just depends. Um, Other characteristics that I have is like I really listen to them. I validate the person, as well as they validate what I have said as well. I think that's that validation, and something also that I've been doing is I've been giving great affirmations to my staff members. I'm always telling them thank you, for the work that you're doing. I'll throw it in the notes when we do projects together or building on pantry or getting laundry stuff ready or passing out dinners. I always tell them thank you for, help supporting the team, because sometimes nobody wants to do some of these jobs because they think they're real minimal, but it's like, hey, if I'm willing to do it, you could do it too. Thanks for the support. So it's always thanking my team at every corner as I can. That's also thanking my program managers of like, hey, thanks for giving me this responsibility as a supervisor to watch over folks and watch my team and help my team grow. You know, a thank you does go a long, long ways.
Agreed. Agreed. All right, so that's kind of come to the end of the questions that I had for Art. But I would love to open this up for folks just as kind of an open area, an open space where folks can ask questions, ask for clarification, let us know your experiences and your thoughts. I think it would be great to see some faces on the camera. As much as I love Art, I've been staring at Art's face for the last 42 minutes. So I would love for some folks, if you feel comfortable, to turn your cameras on and join us in a conversation. If that doesn't feel comfortable to you and you have a question or a comment, please don't hesitate to throw it in the chat, and we will do our best to respond to those. So is there anyone who has anything that they would like to bring up or talk about, or questions?
Go ahead,
Okay, everybody.
Ooh, go ahead, Art.
No, I was gonna say, come on.
I was just going to say, so I did some work in a community health worker project a while ago, and I think sometimes, well, I think there's a lot of interest, and I think community health workers and peer support specialists are sort of in right now. The idea of integrating consumer voice is more and more people want to bring consumers to the table. And I think that some organizations are not always valuing that voice at the same level as some of their other providers or team members. So I think it's a little bit of not tokenism, but just, are you giving the level of decision making or integration of feedback or integration into care teams that you would to other staff? I think there's still some room in the field to say, yes, you're bringing them to the table, but how are you really integrating what they're saying and integrating what they're recommending? And it's not sort of like, okay, this is an example of our peer here, and then not really giving them the responsibility or the I guess the voice that other staff are receiving. And I don't know if, I'm sure there are folks who feel that, but I'm wondering if there are other organizations that see that within their organization a bit.
I mean, also got to look at it this way, that like at our House Service Advisory Council, our T-shirt says "My voice matters," and because at my clinic I get to say what services I want, how I want my services. The doctors need to know and listen to what I have to say, so I'm getting the proper services. So I sort of kind of take that same model over to the work that I do at Do Good. And I tell folks like, hey, your voice matters in what your housing looks like, where you want to live, how you want to live. I don't get to, orchestrate and say, okay, you're going to go get clean, be sober, have a job, and do this. No, your voice matters in this, but also at the same time, your voice matters in the direction that you're going to go, and you want to keep striving forward. But understand that your voice may get interrupted because you may have some obstacles and boundaries, and the landscape might not be what you ideally want, but your voice still matters to say yes or no to something. And like some of them get it, some of them are still trying to learn that concept. And I tell my other folks, like, their voice matters more than me. I'm just help supporting to get it out there. I'm trying to empower that person's voice to be more powerful in the housing they want and they need, or for treatment or medical or whatever it is. Like, yeah, I can orchestrate it, but their voice has got to be the powerful one at the table, even with working with outside folks.
I think, Julia, I think you're right on in so many ways about how many organizations and how the community I think our professional community operates, and I see some change, but I think one thing that I haven't seen a lot of change around, which I think is detrimental to the work, is that salaries I think are huge, and thinking about how if you're in a peer position you make less than a case manager, and if those sorts of things. So that's something that I know within our organization that we have taken a look at, and where does a peer fit in. And I think that's a really hard conversation for some people, especially folks who don't value the peer perspective. But the reality is, and I say this to my supervisors and to folks all the time, is that, in my opinion, folks with lived experience are the most experienced, most useful, helpful people on our teams. They're the folks who know what the needs are of the community because they have been there. And if we should be compensating people for their experience, not necessarily for their educational status, not necessarily for how long you have, how many awards you have and how many certifications you have and all of that sort of thing. So I think it's just how do we shift the thinking and get. And I think when I was asking Art a question earlier just about how do we get how do we get people with lived experience at every level within our organizations? Because I think until we can be at the table, but I hate to say it, but oftentimes we're not at the right table, we're not at every table. And we need to have folks with lived experience at every table, at every level, making these adjustments and making sure that the folks that have the most experience with what we're talking about and what we're doing are compensated, supported, and treated just as well as everyone else. Samantha.
Hi, all. And I really appreciate what Brian and Art, what you just said, and I had privately commented to Brian while Art was answering one of those questions, and just one, it's salary, and two, it's being able to bring people on board in terms of like regulations, and regulations have certain requirements in terms of degrees or diplomas or GEDs, and there may have been somebody that has that lived experience that really can provide the services that we want to provide, but doesn't meet those regulations, and they're automatically disqualified. So how do we go up into the top where, you know, and I understand why regulations are in place. Like, I've been in social work for almost 20 years at this point. So I understand why they're in place in terms of safeguarding, but like, I also feel like we are sometimes the redheaded stepchild of the helping profession. And it really hurts in terms of, you know, you've got somebody who's got that lived experience, who's got those qualifications that can relate to people, who's good with, you know, communicating with people, who knows the community and can really do some good, but we're stopping them with this bureaucratic red tape. So, you know, it's just, how do we get folks on board? And, you know, I'm not trying to be political here, but like, I honestly thought that, you know, some things were going to change with, you know, the current administration. His daughter's a social worker, you know, having, you know, some experience just in our realm of things. And maybe that's gotten sidelined because of COVID, and I can understand that, but, you know, just understanding that there's more people that we can be bringing to the table in this field that may not necessarily have gotten a master's, may not have, you know, finished high school. Maybe they were incarcerated and have that lived experience of being incarcerated, but have turned their life around in some capacity and can be a great mentor, or a peer to somebody who is now coming out of prison. So just trying to change that. I mean, my program works with formerly homeless and formerly incarcerated folks, and everybody on our, you know, in the top levels of service providers all have degrees. And it's not to say that they're not good at what they do, but, you know, trying to bring somebody else on board, you know, every time it's like, oh, but the regulations say this, we have to have somebody that's got this. And it just doesn't seem to fit. And then every time something happens in the world or in our communities, everyone's like, we need more mental health, but they make it so challenging for folks with that lived experience to come on board. And I just, sometimes, you know, I wish I was more of a macro social worker than I am, but trying to use this community to figure out the ways to make those changes, because I think that that's essentially what's important. Thank you.
No, thank you, Samantha. Great points, as Stephen said in the chat. Completely agree. Something that we hadn't talked much about is also just looking at our policies around hiring folks that have criminal records. So, you know, what does that look like? So on one hand, we're asking people to have lived experience that would help them to connect with someone. But if you do have that lived experience that could help you connect with someone, our HR departments are saying we can't hire you because of the lived experience that you have. And so how do we, you know, make changes systemically and institutionally to actually recognize and bring on people that have the experiences that would be so important and so good to be able to help and mentor and support folks that are struggling right now. I think we still have a lot of work to do, but it definitely makes me, you know, it makes me happy to see some of the strides that we have made as a community, and definitely want to highlight the National Healthcare for the Homeless Council has put, you know, a lot of time and energy and resources into making sure that consumer voice is heard. And that the consumer voice is at the table. You know, as Art was saying, you know, in 5 minutes from now, he and I both are going to be on the Healthcare for the Homeless Board of Directors meeting. And there are definitely multiple folks at that table who have lived experience. So just, and not that even within the council, there isn't still more work to do. But just want to say, you know, just want to recognize the consumer movement and all of the hard work of Art and so many other consumers within the Healthcare for the Homeless Council throughout the nation that has really pushed this forward. So thank you, Art. Thank you, folks who have lived experience, who are here joining us and joining your communities and pushing your voice forward. So thank you all. Unless there are any other questions or thoughts, the last piece of our agenda today is Julia is going to let us know about an evaluation.
Yeah. So thank you again, Brian and Art. This was a great conversation. I have 2 pieces of information I want to share before we jump off and give you guys a few minutes to get a drink before your next meeting. First, our conference is coming up in May. We are going to be outside of Seattle, our first in-person conference in a couple of years. We're so excited to see people, to be with people. I hope you can join us. I just put a link to the registration page in the chat. Let us know if you have any questions. Also, when you close out the Zoom, an evaluation is going to pop up. Again, I mentioned this at the top of the meeting, but want to remind you it's really helpful for us to get your feedback. So really encourage you to take just a few minutes to fill out that survey. It's pretty easy. And thank you again for joining us today. We love seeing you. We love connecting with you guys in the field. We have some other great trainings coming up soon, so be sure to check them out on our website. And have a great rest of your Friday, everybody. Take good care. Thank you.
Thank you all.
Bye.